Well, good morning, everyone. I think it's time for an informational update on coronavirus and our response. It's been almost 4 months ago exactly when we had our first virtual service. And I tried my best to bring everyone up to speed on what was known about COVID and what a response should be. Phew, we've been through an ordeal, haven't we? My challenge today is I have to tell you that this is going to be a marathon and not a sprint. We're going to start with a focus on COVID, but I'm going to finish with a spiritual exhortation because the Bible gives us some important insights on what it means to run the race of the Christian life. Now, if you were with us back on March 12th, you will remember this graphic, which presents three types of community response to the pandemic. With no collective response, we would see exponential accumulation of infections that would risk overwhelming healthcare resources with likely serious consequences, including deaths. Now, with a strong collective response, we flatten the curve. We extend the infections over a more protracted period of time, and we give the healthcare system time to care for people and hopefully save lives. Now, the third response is a consequence of perhaps patting ourselves on the back after short-term success and then abandoning all precautions. Everybody remember starting out with such optimism? We can do this. Well, how well did we do? Well, we crushed it. These are Michigan numbers of daily cases. We were in uncontrolled exponential spread from early March to the beginning of April. Remember how all of our lives changed on March 12th? Well, we estimated it would take at least 2 weeks to see any impact from the shelter-in-place strategy, and really maybe 4 to 6 weeks to be confident that we really turned the tide. Well, by mid-June, there was very few new cases statewide, and in Washtenaw, we saw very low numbers. By mid-June, the restrictions start to lift, and we started feeling like we're getting some semblance of our old life back. Now we see the consequences of some of those actions. Cases have been going up now for about 2 weeks. Well, people are feeling, I can't do this anymore. Are you kidding me? I can't believe this. Have you ever been on a hike and you think you're at the end and you get over some hurdle and then you finally have a little bit more vision and you realize you're still so far away? I kind of feel like that. People are feeling, ugh, I can't do this anymore. I can't believe it. I thought we were done. I just want things to go back to the way we were. Well, first let me give you some encouragement about our situation here. We can't do anything about the situation in Florida or Georgia or Texas or California. So let's just focus on the situation in Michigan and specifically in our county, since this is where we can make a difference. So first of all, testing is way up. We're easily testing 4 to 5 times as many people now as we were back in April. The positive test rates in April were ranging between 25 to 40% or higher of those who were tested back then. Now, health researchers tell us that you need to get your positive testing rates under 10% to know you're gaining control. Well, we passed that in May, and we've sustained that. We've got down just under 2% positivity from testing. Now, it's just barely inched up in the last couple of weeks. This is the graph of cumulative cases in Michigan and Washtenaw County. Now, through the end of March, we were still in uncontrolled exponential case growth. That's represented by that black line. And then if you follow the green line, you can see that the curve really started to flatten, and it's remained flat since then. Now, there is a slight uptick in the last couple of weeks, but not the exponential case increases we saw in March. Now, you can also see in this graph in the red that the deaths lag the cases by about 2 weeks. But that curve flattened as well and has also stayed flat. Now, it may be too early to know what will happen from the uptick in the last couple of weeks, but there's still reason to be encouraged. Note particularly how impressive the response has been in Washtenaw County in yellow, where that has remained very, very flat. Now, this is a graph of currently admitted Michigan medicine patients that are COVID positive. We were on the cusp of our capacity by the first week of April. Look how fast that happened. A quarter of these patients were ICU level care with very high death rates. We were just about to start the field hospital, remember that? And then we started to reap the benefits of everyone's collective effort by following the safety precautions. We sacrificed a lot to achieve this. Just at the hospital, our clinical enterprise was almost completely shut down, except for acute care. The financial cost has been unprecedented. However, in response to this impressive success, we've been in ramp-up activity for the whole month of June. Now, what remains encouraging from this chart is that there's barely been a bump in our COVID inpatient care in the last 2 weeks. The state of Michigan last reported at the end of last week a total of 390 inpatients statewide. That's across all hospitals. And hospitals on average are roughly at 74% capacity. So we're still in good shape. Now, I don't want you to throw caution to the wind. I also don't want you to be so overwhelmed that you give up on everything and just plan to hibernate for the foreseeable future. So I want to remind you of the graphic from the beginning. What the challenge before us is, the virus hasn't disappeared. We have to find a way forward that allows us to live and work without risking a return to exponential case infections and overwhelming our healthcare systems again. So here's what we're now emphasizing from the hospital. And we're going to call these the 3 Ds. Reducing the duration of in-person interactions, increasing the distance between people, and reducing the number of different people you interact with. Now, from the very beginning, we've known that your risk of infection is proportional to the time that you are exposed to an infected person, how physically close you are to them, and how many people you are exposed to on a regular basis. This principle has impacted even how we care for patients in the hospital, whether we know that they're infected or not. Now, for months, we've been primarily limited to our households. No school, no church, work from home, no restaurant dining, travel almost non-existent. But we've all been increasing our spheres of interaction. I'm going to advocate that we can enlarge our spheres or our COVID bubbles, whatever you want to call them. However, I want you to try and think of it like a tribe. These can be people that are outside your household, but they're known to you. They could be extended family, your close friends, critical workmates. However, when you have to venture outside your tribe, I would really encourage you to try to follow the 3 Ds. Now, Steffi and I ate at a dine-in restaurant for the first time recently. I think it had been 4 months since the last time. Now, thankfully, it was outside dining. We had good distancing in their setup. We had only a brief encounter with the server, with each of us wearing masks. This was a pretty reasonable practice of the 3 Ds. You might say, okay, Dr. Pipe, but how long are we going to have to do this? Well, I really have no idea. What if I told you until next year? What if I told you it was longer than that? Well, this is what it's going to feel like. We're pulling a huge cart behind us. Think of all the things that we've had to add onto our responsibility, all the disruptions in our life, the challenges for our families, for work life, etc., the financial constraints. We're pulling this huge cart behind us, and there's a destination somewhere in the future, but we can't see the finish line. The Bible gives us some spiritual principles along these lines with respect to our Christian life. We're all on a journey of faith. The Apostle Paul uses the analogy of running a race. We know where we're heading, but we don't see the finish line. It's not a sprint, it's a marathon. It's also not without its challenges. We're warned that it's going to be tough. There will be trials and tribulation, real suffering. We're told that in this world, we will have trouble. But listen to Paul's words from Romans. Not only so, but we also glory in our sufferings because we know that suffering produces perseverance. Perseverance, character, and character, hope. And hope does not put us to shame because God's love has been poured out into our hearts through the Holy Spirit who has been given to us. James tells us, "Blessed is the man who remains steadfast under trial, for when he has stood the test, he will receive the crown of life, which God has promised to those who love him." And the Hebrew writer says, "Let us run with endurance the race that is set before us, fixing our eyes on Jesus, the author and finisher of our faith." Now, our race is not just a personal race. This is a race collective. So this brings us to verses from our text today that will be part of our sermon in 1 Corinthians. In chapter 3, we read, "So neither he who plants nor he who waters is anything, but only God who gives the growth. He who plants and he who waters are one, and each will receive his wages according to his labor. For we are God's fellow workers. You are God's field, God's building." So this is how we should be thinking as we are running this race. Think of it as the group collective here. We're looking for growth of God's field. We're looking for the building up of God's building. We're all part of that. As the text says, some of us are going to plant. Some of us are going to water. God's going to give the growth. But we're all in this together. We have limitations right now. We have challenges as a church. But the goal here hasn't changed. The gospel message still has to go out. We still have to be the church. I know we're all longing to meet face to face, but there's churches all over the globe that don't get to meet face to face. There's churches that have to meet underground. There's churches that have to meet just by communicating through electronic communications. This is a time of trial for us as a church. We don't know when it's going to end, but we do know that our purpose hasn't changed. God can use this time to reach. As we sang today from that song from Ren Collective, we are the church. We are the hope. As the body of Christ in this world, we have to go out and we have to communicate that hope. That's what our reach mission is as a church. And it's also what's driving behind the Sack Lunch Saints initiative. We need to innovate and use whatever gifts and opportunity God gives us so that we can communicate hope. So let's remember that as we deal with our challenges every day, but let's all continue to labor together for the work that God has called us to.